Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Geoff Tyrrell. He is a palliative care chaplain, and he wrote the Kevin MD article, Faced with Terrible Decisions, but Making the Right Choices. Geoff, welcome to the show.
Thank you so much, Kevin. Very happy to be here.
So we're going to get into your article in a bit, but first off, tell me your story and your journey to where you are today.
All right. I'm Irish. I came to the US about 30 years ago. I was lucky enough to win a green card in one of those immigration lotteries. Back in the 80s, we were having a big recession, so everybody was leaving, and the joke was, the last one out, turn out the lights. So I got a start, and I worked in high tech in the Bay Area, and I went to school part-time, doing a Doctor of Ministry degree, and studied psychotherapy, somatic psychotherapy in the Bay Area. And then I eventually became a chaplain resident at Stanford Hospital. Once I became a chaplain, I worked in home hospice in San Francisco, and I liked it. I liked the teamwork. And so I was offered a chance to do a fellowship in palliative care at Stanford, not at Stanford, at the VA in Palo Alto, and that's how I got started with palliative care.
Share with my audience some of the things that you do on a day-to-day basis.
Sure. Well, my main role is visiting patients, and so I will just check in with them, say hello. I try to put them in the driving seat so they know that, if they don't want to talk to me, that's completely fine. I'm basically establishing trust and trying to help them to find ways of finding strength, finding meaning, finding comfort in the hospital setting. I also am involved in some institutional interventions to help staff, physicians, nurses, doctors, all disciplines, through Schwartz rounds and Berlin groups. So those are opportunities for people to come together and share their experiences, to integrate things that might have happened that might be troubling them, cases that might have been really hard in one way or another, and to find, support from other members of the community of healthcare workers and build compassion. So those probably are my main focuses.
And what are some of the ways that you use to bring comfort to patients and their families?
Well, it very much depends on what's meaningful to them in the moment. So if they are open to it, I'm happy to pray with people, of course. I listen a lot. I try to, be very empathic to let them know that, in fact, somebody's listening to them, taking the time to be with them. I think those are the main things. We do, obviously, the things you'd expect, sacramental ministry. We have a national cemetery about a mile away from us on our campus, and the chaplains will go down there and do memorials, funerals, that kind of thing. But most of my work is actually, one-on-one with the patient. These days, we're calling families, trying to, make sure they know we're here for them as well.
And over the last 4 to 5 months during the pandemic, how has that changed what you've been seeing day to day, either in a palliative care setting or in the hospital?
Well, I would say maybe one of the big changes is just the level of fear and worries that the staff have. So we've really tried to, and certainly I have tried to take more time to connect with the staff, with the nurses on the floor. We've been doing more virtual Schwartz rounds. So we've been doing like this, offering Schwartz rounds in this forum, and it's different, but it's still providing connection and support to staff members.
And you mentioned Schwartz rounds a couple of times. And for those listeners who may not be familiar with Schwartz rounds, could you explain what they are?
Sure. Schwartz rounds are groups where all members of the institution are invited to come. They're not for patients, they're not for families. They're a place where we can come and talk about our subjective experiences, what it felt like when we were taking care of this kind of patient, what it meant to me when I heard somebody telling me this, things that might rankle, that might, cause us to doubt ourselves, that might have been upsetting or painful in some emotional or inner way. So that's, what we don't have a lot of those kind of opportunities. And we really began it because we were having folks really struggle with hard things. Specifically, in one case, a resident, his friend, who is also a resident in New York, committed suicide. And the attending on his team was really reaching out to wonder, how can we support, this resident. Then he had the same resident had a procedure in the ICU, which he was doing, had a bad outcome the very next day after the suicide. So it was a very tough time for him and his team. We tried different things, and we tried Schwartz rounds. We found there was, receptivity to that folks would participate, and sometimes that's a challenge. Who's got time in a busy day, to talk about these things? But somehow, folks will take the time out and come and participate.
I think it's tremendously important for anyone within the healthcare milieu to have that type of support from their peers.
Yeah.
So you wrote the Kevin MD article, Faced with Terrible Decisions, but Making the Right Choice. And I want to read a short excerpt from that article. And
Right.
You write, how are providers to cope with the trauma they are experiencing in New York and Italy, and presumably other nations as well? How are they to cope with the moral implications of the brutal decisions they'll be called on to make if two critically ill patients compete for the same life-sustaining treatment when only one is available? Now, tell me the story behind that article and why you decided to write it.
Sure. So this was going back to those very early days when the virus was really taking off, catching fire, and the worry was that there really weren't going to be enough resources. What were we going to do if we did have that situation where there really were not enough, critical care resources? And we were having real conversations in palliative care. There were ethical issues, there were kind of organizational issues. And as we were thinking about that, my kind of spiritual side was thinking about scripture. And I remembered, that there was this story from ancient India in the Bhagavad Gita of a great warrior who was faced with a tremendously hard choice. Whatever he did, he would have to kill somebody or disgrace his family or worse. So there were no good outcomes. What was he going to do? I thought that by bringing that kind of piece into this question about really hard choices in the hospital, it might help folks to think about it, to find a little bit more space around these really tough choices.
Well, thank you so much for sharing that. I think it was a tremendously poignant read. We're talking to Geoff Tyrrell. He's a palliative care chaplain and wrote the Kevin MD article, Faced with Terrible Decisions, but Making the Right Choices. Geoff, as a palliative care chaplain, what's a number one tip that you could share with the clinicians who may be listening to this podcast?
Number one tip. I'm going to step back a little bit, give you a quote from Rumi. Out there, beyond ideas of right doing and wrong doing, there is a field. I'll meet you there. I think what that's talking about is going beyond ideas, right? We have to work with ideas in our job. We have to know a lot of things. We have to build on experience, our own and other people's. But there comes a point where to be wise, to be healthy, to be able to cope with stress, we have to go beyond the intellect. And Rumi says, beyond the intellect, there's a field. And I think as scientists, as clinicians, you can think about quantum fields. You can think about quantum mechanics. can think about things having a very different, different laws of nature working at different energy levels and time and distance scales. And so the mystics really understood something very practical, which is that by going beyond thought, beyond the intellect, beyond knowledge even, we find something very real and something very nourishing. And this is why many wise people have encouraged meditation for people who believe in a deity, in a prayer, in spiritual practice. And I would say it's not just a matter of belief, it's a matter of experience. We need the experience of going beyond the intellect. We need to be able to go beyond the things that are troubling us and find nourishment within. So we create Schwartz rounds, Berlin groups. There are other interventions that one can do to cope with stress. But I think that inner nourishment is very important too. And especially these days when, folks are very, very overworked, when they're troubled, they're seeing people on the beaches, going to bars without masks, feeling really upset. This is another moral dilemma. It's another moral injury. I'm sitting here, like the doctor might be saying, I'm sitting here, or I'm working all day long with a mask on, with gowns, PPE. I'm going through this to save your life, and you're not willing to wear a mask outside. These kind of stressors, they demand a response. And I would really say, without trying to be a zealot or trying to sell a spirituality, that there really is value in finding a way to that field where you can let go of all of the memories and the stressors and feel some peace. And once you have that peace within, you can go back out into the world again. You can go back out onto the battlefield, rested in a spiritual sense.
Well, thank you so much for sharing your insight and perspective, and thank you for the time and being on the show.
Thank you very much, Kevin.